Good afternoon. I'm Mo Wright, Chair of the CMC Board of Trustees and President of Raymond Consulting, and it's so great to see so many of you. Today we present a forum focused on childhood mental health and behavioral health. It's sponsored by Taft Law and Grange Insurance, and they're represented today by many of their associates in the room. Won't you please help me in thanking them for their support? And I'm going to welcome to the stage Kathy Dunley from Taft to introduce our forum and our speakers today. Kathy?
Thank you, Matt. Thanks. Taft Law is proud to support the Metropolitan Club, celebrating diversity, discussion, and debate, and where we have convened public conversations on important topics every week for the past 40 years. Today, we will engage a conversation on the tough topic of children's mental and behavioral health. Our kids are our future, so it is critical that we provide them a nurturing, supportive, and enriching environment for them to succeed and achieve in life. Let's introduce our speakers to learn more. The CEO of ADAMH, David Royer, CEO of Syntero, Julie Rinaldi, CEO of Big Lots, David Campisi, Chief of Psychiatry and Medical Director of Behavioral Health, Nationwide Children's Hospital, David Axelson, and our host today from WOSU, Ann Fisher. David will start us off with a quick overview of the report and offer a parent's perspective. Then Ann will lead the conversation. David, the podium's yours.
Thanks so much, and thanks to the Metro Club for hosting this important conversation regarding behavioral mental health in our youth. On behalf of Nationwide Children's Hospital, ADAMH, Syntero, and our business community partner Big Lots, we are grateful for this forum that recognizes the importance of the whole child. Addressing mental illness is just as important as physical illness in producing the best outcomes for our children. Unfortunately, 1 in 5 children are faced with the challenge of a mental health disorder before they reach the age of 18, and half of the time they actually do not get any behavioral health treatment. In addition, the majority of mental illness actually starts in childhood and adolescence, not in adulthood. In some ways, whether it's a family member, friend, colleague, or even through personal experience, almost everyone is touched by mental illness. Let me take a minute to describe this edition of the Full Potential Report that you have here. It's Seeking Solutions and Providing Hope, a look at behavioral health and mental health in Central Ohio youth. First, I would be remiss if I didn't recognize all of the partners, patients, families, and clinicians that contributed. Their insights were instrumental in pulling this all together for the entire community to be educated. In prior Full Potential reports, we underscored a range of issues from childhood obesity to prematurity. By bringing together the perspectives of many in the community, we've been able to see progress and awareness and solutions of these areas. In this report, with the help of many behavioral and mental health leaders here today, we came together to discuss the challenges in Central Ohio. We talked about the gaps in services, resources, and proposed ways to improve access. This Full Potential report also offers a glimpse into the experiences of 6 young people who found treatment and of a mother who knows the impact of mental illness and addiction. Their stories tell the real struggle of how to come to grips with their condition. We applaud the courage of these patients and others out there who have shared their stories. Every time someone is able to reveal his or her struggle, the stigma of having a mental illness diminishes slightly. One very brave parent is here today to give us insight into her family's journey and their road to recovery and hope. Let me introduce you to Jamie Ingledew, and thank you, Jamie, for sharing your experience with us today.
Thank you. Thank you so much for having me here today, and I'm so happy to see so many community and business partners here. It's great. It's so important to have support and access to services, and as a parent, it makes me really happy to see us as a community working together to expand access to professional help. We got access to professional help through the staff at Nationwide Children's Hospital Behavioral Health, and I can say without a doubt it saved my daughter's life. In 2013, she was spiraling into what became a very deep depression, exacerbated by a very ill-timed concussion, panic attacks in the bathroom at school, a former honors student failing her classes, risky and completely uncharacteristic behaviors like stealing, promiscuity, lying, smoking, just nothing you want to deal with as a parent. And then the cutting began. And then we found out she just wanted to die. And thank God we had access and could get in quickly. I can't describe the relief I felt after we met with a psychiatrist and left with multiple diagnoses and multiple prescriptions. And for the first time in a long time, hope. And then we started to see a psychologist for her therapy at Nationwide Children's. And I feel like one doctor saved her life, and the next one helped her see a new path for her life and helped her build that path. And the biggest thing they both did was that they really listened. They listened very carefully to every word we both said, and they knew that the real expert on my daughter was my daughter and me. And so now she's learning to build her own path with the coping skills and the cognitive thinking techniques she's learning with Dr. Ackerman, the psychologist. And as he often tells her, depression sucks. I love that he's so honest like that. And it's not fair, which is the teenager's favorite phrase, of course, but we can't let it run our lives. And on that note, my experience of parenting is that for years you try to teach them something and you say the same things over and over again and you feel like you're getting nowhere and they roll their eyes at you. And then, you hear them like spouting off in the backseat to their friends the same thing you've been saying for 5 years. And I think that's what's happening now. I see, she doesn't respond when I say something, but then I see her telling other people that, or I see her putting those cognitive skills to use every day. And she's taking ownership of them. I hear her reference them in offhand conversation. And so now she has been about 5 weeks now, I think, at Wittenberg University studying music on a scholarship. And she is adjusting to all the changes and challenges that come with that pretty well. She's getting herself up into class every morning, which is a small miracle to me, who's been waking her up every day. But there's absolutely no way she would be there without the excellent care and support we've gotten from Nationwide Children's Hospital staff. So she still has bad days, and I've gotten a few texts on those days, and fall is historically a pretty hard time for her, so I do worry about her being off on her own and managing it. And this will be an ongoing journey that she will have to manage for the rest of her life. But the difference between managing her illness and something like diabetes is that when diabetic patients take their medication, they don't feel like a total failure, as my daughter said. That's why she hated to take her meds. They don't have teachers telling them they're just making excuses to get out of their homework. They don't have people telling them to just get over their diabetes. So it makes me really excited to see so many community partners and interested parents and business leaders, behavioral health experts here to share in this journey and help reduce the stigma associated with mental illness. We love to say it takes a village to raise a child, but from a parent's perspective, we don't have that village, and we're sinking under the weight of that, honestly. So that's why it makes me so happy to see everyone in the community working together on trying to build that village again, because it takes more than just the medical community to do that. It really does. And I hope this means more outreach to the community as well, as I know Nationwide Children's Hospital and all of the organizations here today are working on to bring more awareness of mental illness and work on erasing that stigma. And everyone who tells their story, I feel, helps to do that and help someone feel less alone in their struggle. So I hope that by sharing our story, I've done that a little bit as well. Thank you.
Thank you, Jamie. Let's get started. No time like the present. I remember when I applied for my job at WOSU, one of the questions they asked me is, will you do shows on mental health? And it was like, it's everywhere. I mean, that's part of it, is it when we're talking about mental health, when we have to define it every time we talk about it, but you see it everywhere. David Axelson, is it the issue is becoming more pronounced? We're more educated about it? Are there more children who have mental illness and behavioral issues, or what's going on?
So that's a great question, and I think that even the Centers for Disease Control has said that there's been an increase in the reported diagnosis of some mental illnesses in kids and teenagers. Whether it's due to a true increase in prevalence, like there's actually more mental illness out there, as opposed to better recognition and diagnosis, is unclear, and it's probably likely a combination of both things. However, there is some pretty hard evidence that unfortunately things like the rate of completed suicide in youth has increased by 40% over the past 8 years. So there's definitely a concern that this is at least some increased prevalence, as well as the good thing is better recognition and diagnosis.
You know, and I see Columbus Health Commissioner Teresa Long in the audience, and I think this is also a public health issue. That's what ADAMH does, is deal with it on that level. So, David Royer, are you seeing these increases, these surges of issues?
Yeah, you know, over the last 15, 16 years, the rate of children and their parents presenting has grown significantly. And I go back to what David said. I think it's twofold. There are a lot more stressors that perhaps we didn't experience through adolescence. But I think the other part of it is that so many more professionals that come in contact with children are much more aware of issues surrounding behavioral issues, mental illness, education. There's hardly a teacher now that can't recognize early on first grade teachers, kindergarten teachers, second grade teachers. They're recognizing some of these issues at a very early onset. And I think so, as whether it's a pediatrician or a school teacher, it's just this general notion that we are becoming more aware, more sensitized to some of the challenges that our young folks are facing.
But going back to that point that Jamie Ingledew made about a lot of times parents with children who struggle with mental health or behavioral issues, they don't feel like they have that community behind them. So Julie Rinaldi, what about your experiences from where you sit as a CEO of a provider and also as a parent?
Unfortunately, my life as a professional and my life as a parent have intersected on a number of levels. But so as a parent, we lost my stepdaughter to suicide in 2004. And that really has created, for me, more of a sense of urgency, even though I had it before, and passion to really reach out more to the community and partner with folks, because it's not just our agency reaching out and making those connections. It's all of us in this room. It's everybody that touches children and families in any way. So you kind of take that off of the shelf in terms of this is just my problem. This is just my problem to solve. I see more and more of an openness as a parent and as a professional to folks being more open to partner and collaborate and to do the right thing for children and families. And there's lots of examples of that in the community right now. And this is the best place to be, as far as I'm concerned, in Columbus, Ohio, to make those changes and be that example.
Maybe not the least of which because David Campisi and Big Lots, your organization has donated $50 million to Nationwide Children's to get this going.
Yeah, listen, there's a few folks in this room that have heard the story over and over again, including my executive team, but who sat in a room with me for a couple hours, and we finally held hands and made the decision because we see that the lack of funding, and it's all about the kids, and we want to do more. And I invited a couple of our associates, one from the corporate office and one from our field out that are in the room today, that both shared their stories with me, and many, many others. And it's our goal to get to these kids early. The Behavioral Health Pavilion is going to help us do that and remove that stigma that you talked about. That's the biggest thing. Is my wife, her sister took her life when she was 14 years old, her parents never talked about it. She died on Thanksgiving Day. And, you know, those kinds of things that you hear, and then you realize that it's time to do the right thing. And for myself and my team, we made that decision to step up. And honestly, Steve Allen told me something a week ago or 2 weeks ago that I did not know. We certainly didn't do it for notoriety. We did it because it's the right thing to do for kids, but we didn't realize it was the single largest corporate gift for behavioral health. So with that being said, you know, we're hoping that other companies, thank you. You know, so again, the goal there is to remove the stigma across the country. We have we operate in 47 states. So take this thing national, not just Central Ohio. The hospital serves all 50 states, and we want to do more, and certainly our associates do too. So we're hoping other companies will step up and start the conversation and join in with us. And I guess the last thing that I would just add to that, Ann, is I've been asked to tell the story about my daughter, Ashley, who's in Denver, getting her graduate degree in this type of work. And really quickly, I know I'm short on time, but after David spoke at a board meeting, and I always remember asking Steve, why do you want me on the board? But I joined the board last fall. It was quite an honor to do that. I had no idea what to expect. But when David came in one day and did his presentation, I was speechless. And I'd been giving her a hard time for years about, you're going to be poor your whole life. What are you doing? So she's been volunteering at the Denver Children's Hospital, and she sort of, in the last 3 or 4 months, decided she may not want to do this, because what she said to me was, I don't know what to do. I can't help these kids. There's nowhere to put them. There's no beds. I couldn't tell her. We had already made this decision to do what we're doing today, but when she found out, she certainly went crazy. I shouldn't use that word, right? But probably a bad choice of words. My apologies. But and then
We'll help her with
and I had Dr. Axelson speak to her on the phone to talk her off the cliff. So anyway, that's our story, and I'm proud of our people, and I'm proud of our executive team, and I'm thrilled to be part of this community. Thank you.
I'd like all of you to address this question, but start with David Axelson. As you know, where do you start to spend $50 million on this? What do you spend it on?
Well, you know, as Julie had said, that we do want to sort of develop a system of collaboration among community providers, and that no one system is going to be able, or no one agency is going to be able to take this on. And it's not something that is just done through mental health care as well. I mean, I think that we have to think about the community broadly and having healthy neighborhoods and healthy schools. So thinking about it broadly. But you know, in spending the money, I think really the pavilion itself is the key component for a couple of reasons. One is, as David Campisi was saying, I think it can provide a sort of beacon or sort of a marker for that this is an important problem that Nationwide Children's, Big Lots, and other community partners really see mental and behavioral health is just as important as physical illness. So I think that's one component. The second aspect of the pavilion I think will be helpful is it'll be a great place for training the next generation of providers. It takes a real team-based approach to help these kids and families, and we don't have enough people doing it. And we also need to have a place that is both inviting to people that make them excited about joining this effort, and also efficient, where they can learn in different settings, from emergency care to inpatient to outpatient to community-based services, can all be based in this pavilion. So I think that, Mr. Campisi, we're so lucky to have Big Lots and other great donors too. Wolf Family, we had other great donations to help support us, but I think we're going to be investing in that building as sort of a hub that then we can also partner with other agencies in the community, and we'll take on sort of the emergency crisis service aspect of things, which we've partnered with ADAMH specifically on the child and adolescent end, but then work with others to other great providers that provide outpatient intensive outpatient, residential, and other services.
You know, from the ADAMH perspective, I can tell you that, you know, one of the great things about being here in Franklin County is that our community values these issues. And they do it in a variety of ways. And so when David mentions the hub, I think it's really important to recognize that there are a constellation of child-serving agencies in the behavioral health sector, but also in areas of prevention and education and outreach that are all striving to build healthy and resilient children. And so what's nice about the training issue with the pavilion also is one of our biggest hurdles is workforce. We struggle here in Franklin County, and there's no place better to live in Ohio than Columbus and Franklin County, and yet we experience a tremendous shortage of qualified healthcare, behavioral health care professionals. And so I'd like to also believe that this can create a synergy that says there's something unique here, there's something different here. It is about a community ethic that says we embrace the wellness of our children, not just physically, but emotionally.
And that reminds me, David Campisi, of the story about your daughter, you know, wanting to go into behavioral health, and you're like, well, where are the plan on being poor? There's no jobs. There's a big demand.
Yeah, there is. And you know what? I think Doctor talked her off the ledge. And when she saw the release and the picture of the building, her whole issue is in Denver. They have the same problem everywhere else does at the Children's Hospital there. And I'm sure Dr. Allen knows who runs that operation. And her comment was purely what you guys are talking about. There's not enough help. We don't know what to do. It's painful. We're sending kids home, and we know we shouldn't. So, again, this behavioral health pavilion is the first Children's Hospital behavioral health pavilion with plenty of beds for these kids, and that's really kind of what that was like an epic moment for her to hear that, because again, you know, hopefully she went back to the folks at Denver Children's Hospital and said, see, look what my dad's doing. So
Julie Rinaldi, you know, given your past and the sadness that's been in it and what you do, does it feel like things have changed much over the past 12 or 13 years? Is there more?
Definitely, things have changed. I'm very hopeful. I'm very hopeful that there is, as David said, a constellation of providers and folks in the community that are banding together to address this issue. We receive, and a lot of other ADAMH providers receive, local levy dollars to provide services in the schools, in the local schools. We have been able to, with those dollars, and thank you for anybody who voted for the levy, we appreciate that. Please do that again in a couple years. But those local dollars enable us to be able to reach out to students in the schools and provide universal screening of students. And that's just not our organization. It's a number of organizations who are represented in this room. But we are able to go out and do universal screenings and flag children who need intervention and intervene with them at an earlier time, because basically I'm very excited that we're going to have more resources at the inpatient level, but a bunch of folks in this room are doing everything we can to keep those kids out of the hospital. So if they need hospitalization, I'm so grateful that there will be a great resource for them, but a bunch of us out there are going to, including children's, are going to try to keep them out of there. So I think I'm very hopeful that we have a lot of folks in this community that are addressing this issue together.
Yeah, I just want to add into what Julie said is that really we work very hard to keep kids out of the hospital, that we really want to link them up with help in their home, in their community, in their school. And so even though this is a big building, you know, a major focus of it is actually going to be crisis assessment and management and trying to not hospitalize them. And I will also put a plug, I think, for what we were saying about the levy and the use, really the importance of funding broadly that, this to address the mental health issues that we have in this community. We can't rely on just sort of billing therapy and doctors and things like that. Certainly the medical and therapy aspect is very important, but there are also prevention efforts and community outreach efforts that require different kinds of funding sources. And so I think that's extremely important to remember.
In a few minutes, we're going to move to the audience questions. So start thinking, because it'll be just a few minutes from now. But let me ask you this one final thought. I know that it's more than just therapy and that sort of a thing, like you said, but there is a crucial shortage of behavioral health care professionals, psychiatrists, psychologists, counselors of every stripe when it comes to children. Why the shortage? What is the disincentive to go into this field?
Go ahead.
Yeah, you take that.
Well, one is it's hard work. I mean, it's really, really hard work. When you see children suffer, when you see families suffer, when you see an adult with mental illness and essentially the quality of life that they struggle with, it's very hard work, and it's very exhausting. It's emotionally hard work. And so I think that has one of the causes. I think the other one, you can't escape, is the economics of choosing to do this for a living. We have undervalued mental illness, and we've undervalued emotional well-being of children. And when we undervalue something, we tend not to put our money where we don't value. And so what's so remarkable about this panel today, and you in the audience, and the leadership of Big Lots, is that it's a step about increasing the value of how we view these challenges and these individuals. And I think if we can continue down this path of valuing a person with a mental illness as much as hypothetically some other form of a chronic illness, that will take care of itself. Just as an aside, the commitment of Children's Hospital, their board of trustees, and Dr. Allen and their vision, and David's vision to value these issues. I've been doing this a long time, and I will tell you that it was a watershed moment when they shared with me how they envision taking care of children, because up to now we've fallen short in many ways about the emotional needs of children. We react to it, but we don't proactively seek solutions at a level that we should. At least that's my take.
Anyone else?
I would just add to that there was a few months ago, there was a clinical psychologist on the news that I was listening to, and her response was not only kind of like everybody that has a calling, whether it's school teachers or this field as well, and social work, they're truly undervalued and underpaid. But her comment was pretty staggering, and that was that they're leaving the field because they can't take care of these kids. There's nowhere, again, whether it's keeping them in inpatient or outpatient, but they're not able to really help them, and they know in a lot of cases they shouldn't be sending them home. And so I think they live in this place of pain themselves, and that's what she was saying on the news, that is why they're leaving as well. So
I will say some of it may be a little bit of marketing too. In a couple of different ways. I mean, one thing that's difficult is, brain-based disorders. You can't do a blood test. You can't do an X-ray. You can't put something up to your head, a stethoscope, and say this is what the problem is. Which is in some ways one of the great things about working in this area is it really requires a great deal of skill and compassion and being able to listen and take in the whole picture. But it does make it less cut and dry, and that's can be difficult as to attract practitioners in that area. I think also that we need to do a better job of, although we aren't always able to help everybody completely, we don't get complete cures all the time, that what we do does make an impact for most families and most kids. And so we have some treatments that do work and things that we can do to help folks, and we need to market that a little bit better, that we can do something, although it may not be perfect, may not be complete, it can really help folks manage with the problems that they're struggling with.
Thank you. It is CMC's tradition, Columbus Metropolitan Club's tradition, to take audience questions. Please state your name, ask your question, and we thank you in advance for not making long editorial comments. So let's proceed with the first question.
Hi, my name's Marie Trudeau. I'm with W.E. Davis Insurance. Have spent the last few years really studying the Affordable Care Act, Obamacare, and I feel it should have changed the landscape in mental illness because it changed the definition. There are no longer limits on mental illness treatment in policies. You can be depressed, you can be diabetic, it doesn't matter. It's an illness and it's treated. But it got very little press. People that I talk to don't know that. From your perspective, do you see it making an effect or in the future? I mean, you talked a lot about money and money not being there, but if it's an insured situation, wouldn't there be more money there? Thank you.
Do you want me to? All right, well, I think all of us could probably say something. It's a great point that we have made some real strides with the Affordable Care Act and the Mental Health Parity Act to be able to get mental health and mental illness in at least nominally on par with other medical conditions. Some of the challenges are, I would say, that even though there still are barriers in many policies, whether they're formal or informal, the other thing is still this is expensive work, and so the reimbursement rates that are assigned for the kind of work that's done sometimes is not sufficient. But I don't want to minimize the fact that it is a great stride forward, that those changes have been made, and it gives us some hope. But there are some things to break through in really implementing that. I don't know if David.
Yeah, one of the things that we have benefited clearly from here in Ohio has been the expansion of Medicaid. The fact that now there is a revenue source is a positive, and I think one of the unsung benefits that has happened for people with behavioral health challenges is that it now affords them physical health care. And David and Julie are experts about the comorbidity issues surrounding mental illness and addiction. But the fact now that people can actually get physical health care as well as behavioral health care really does, in the long run, improve the quality of life for people with addictions and mental illness.
Definitely. I think for us, one of the dynamics that's changed with the ACA implementation is just the emergence of high deductible plans, which are probably almost everybody in this room has a high deductible plan. So folks are having to be forced to make choices about what kind of care they access, and again goes back to do I go to get treated for a physical illness versus a mental health or other behavioral health care issues. So that's one of the things that we as an organization and I think as a community need to sort of discuss and try to figure out how best to treat folks and encourage folks to get that care, even though they're going to be having to pay a premium for it in some cases.
Yep. Next question.
My name is Franklin Conaway, and I have a background in comparative urban planning and land use planning, which simply means I lived in Europe and did a significant amount of research on European town planning and land use planning process as compared to ours. And a subject that I've been fascinated by for years, I also have a legal background, that's why I'm asking the question, is the impact of aesthetics on mental health, or the lack of aesthetics on mental health. In Europe, generally, the idea that people are happier and mentally more alert and in tune with their environment and other human beings is taken for granted, and they have a legal system that backs that up and creates beautiful cities for everyone. I realize that some of the disorders that our children are facing would not respond particularly to a better quality physical environment, but I'd like to know what importance you place on this subject.
I would be happy to start with that. We take that very seriously, sir. We look at our physical environment at our organization, I think others do as well, and try to make sure that it's non-institutional feeling, that it's welcoming, and that families and children feel welcomed and warmth, both from our staff, but also the physical environment around them. It's very important, very important. And so for our organization, Syntero, we take that very seriously. And I would welcome you to come over and visit us and see if you have any suggestions. So.
And thinking about just sort of the civic planning and city planning aspects, recent study showing that increased green space in certain neighborhoods actually reduced the amount of behavioral problems in kids and teenagers. So I think you have a real point there that how we design our neighborhoods, how we design our cities can have, although it's not going to cure everything, can have positive benefits on behavior and how people's outlook.
It kind of goes to that whole stressor issue, right? Is we're making our world less stressful when we make it not necessarily just more beautiful, but easier to negotiate, easier to look at. Yeah. Next question.
Thanks. I'm Dr. Bobby Celeste. I'm a psychologist. I work with the Ohio Psychological Association. Just thrilled, and thank you so much for all that you all are doing and for being here to share. I'm especially excited to hear about training and workforce development issues and integrated teams. As you said, we know that's what works best for kids and probably for adults too. But I just want to raise an issue that relates to the workforce development related specifically to psychology and probably other fields as well. A lot of our graduate students, when they're done with their psychology training and ready for their license, have as much as $100,000 in debt. And so that's a big hurdle and barrier for many students to going into the field. We're asking what are the barriers for going in the field. So if you all have any ideas or creative energy around how we can do more to support folks even during their training, I think that would be really, really helpful.
So I guess kind of like incentivizing it a little bit.
You know, one of the things we've done is partnered with the Department of Social Work at Ohio State and continue to look at strategies that allow bachelor level folks to come in through special cohorts where we can maximize the financing because of the issue of crushing student debt. One of the things that you know I think we ought to have a conversation about is whether it's with Senator Brown or Senator Portman, is the notion that we have to start to look at retiring student debt through, especially within the context of the urban areas. And whether, you know, for a long time we've had rural-based programs, but I think we really need to rethink some of the strategies about how do we incentivize professionals to work in urban communities. You know, the fact is that the rates are higher in an urban community. We know that people come from, because of the availability of services, we net more people into the community, into Franklin County than transfer out of Franklin County relative to behavioral health challenges. But I think at the end of the day, if we want to, there's ways to incentivize, whether it's partnerships between county government and Ohio State, or whether it's through debt retirement. But urban areas are especially hard pressed because the demand load is so high here.
Thank you.
Good afternoon. My name is Brenda Fields. I am the Education Program Supervisor with the Capital Kids Enrichment Program with the City of Columbus. One of the things that I always wonder about, our target group is K through 5. Then I temporarily lose my mind and I take middle school and high schoolers in the summer. But what I have found the commonality is that there's always issues, mental health issues. The question is, where are the resources that are listed, or is there some place where a warehouse where I can tell a parent, this is where you need to call, this is where you need to go, because I don't have that, and I'm always looking for a warehouse or someplace to say, where can these people get help? And they always say, I don't know where to go, and I want to help them, but I don't know how.
So I think that's something that we need to actually do a better job as a community to actually get some of that information out there. And I think the Full Potential Report was sort of one step in trying to do that. I think we have some more work to be able to do that, to link, to make it easier. We did, with a partnership with Franklin County ADAMH, did set up the psychiatric crisis 24-hour phone line, which is a resource when folks are really at in crisis, to be able to link folks and be able to say whether we need to see you, whether we can get you to a crisis center or to link you to services. So that is one situation, but that would be overwhelmed. That's not exactly what you're talking about, and I think we could do some more in that respect.
Yeah, real quickly, if you go to ADAMHfranklin.org, and you go on the website, you'll see a tab for providers, and I believe that you can actually then go in and look at child-serving providers. I know Buckeye Ranch is here, Directions for Youth and Family are here. So there's a list of probably close to 40 nonprofits. Now, not all of them obviously serve children, but ADAMHfranklin.org, and I think you can find a pretty comprehensive list of services available in the community.
Yes, thank you so much, because they're our babies. They need help, and we can't ignore them. They're part of all of us, so that's something important to share with the parents, get them involved. Thank you.
Thank you.
Hello, my name is Vincent Day. My question is, I was chair of a board of a national organization called Active Minds. And one of the biggest questions that we always grapple with is, how do you change the conversation about mental health on colleges? And I guess one of the things that I think about when you talk about community, you talk about conversations, you talk about more information, is how do you get people who are running institutions, and I'll talk about educational institutions, especially higher education, to really change the conversation about behavioral health and how it's dealt with and services available and how to help those kids who are in school and certain things manifest themselves their freshman year, et cetera. We knew someone who was at Ohio State who committed suicide before school started. And so I guess the biggest challenge is that people know that there's a crisis, people know that there are issues, but we can't seem to change the conversation. So how as you think about moving forward, as you think about all the things that are happening, the wonderful things that are happening here in Columbus, how do we begin to get people to really change the conversation and have an impact on college campuses?
I'll give you the quick version. One of the things that we've done is we reached out to every suburban school district superintendent and we asked them, how can we help your needs? Tell us what you need. And through that, we funded, I think 15 school districts now have a relationship like Syntero with Dublin schools or Hilliard schools. And so in a reactive context, there was a tremendous response by the school superintendents to say, wow, we really need mental health presence in our districts. But I think the challenge more strategically is, how do we start to bend the conversation to making mental health more organic to the educational process? How do we start to if you will, recognize that children that are doing well emotionally are going to do far better academically. And the more we make it organic to the educational process, that is emotional well-being and mental health care and things like that, I think all the efforts about education improvement will only accelerate, and there are tremendous efforts out there. But my experience has been they feel under siege, they need help, they've been responsive to our offer, but ultimately, when we embrace children's well-being, emotional well-being in the educational environment, they are going to succeed.
Thank you, everyone. You've been a wonderful audience. I'll send it.
Such an important conversation. It certainly won't end today. A lot more work to do, but let's thank our sponsors for today, Taft Law and Grange Insurance. And to all of our speakers, Ann Fisher, David Axelson, David Royer, Julie Rinaldi, and David Campisi. I didn't realize how many Davids were on the panel today. That's what I actually read that. It's David Day. As you know, you can always replay our forums on Columbus Television, through WOSU, PBS affiliates throughout the state, and of course through the CMC website via our YouTube channel. Thank you all for being here, and we'll see you next week.